Hello students, welcome to this session on course on basics of blood bank. Let's study blood transfusion procedure and reactions. Blood transfusion procedure. This is a following point should be noted. Particulars noted on bottles should be tallied with particulars of the patient. Patient should be resting. Blood transfusion should be started in morning. After starting transfusion, first 50 ml should be transfused very slowly. Then rate is adjusted as required. Record pulse, blood pressure, temperature, respiratory rate, and examine chest. Time of starting transfusion should be it should be immediately stopped on occurrence of any transfusion reaction. Maintain urine output chart and color of the urine. Time at which transfusion is completed and amount given should be noted. Following measures should be taken immediately on occurrence of reaction. Transfusion should be stopped immediately and medical officer in charge of blood bank informed. Normal saline or glucose saline should be started through vein on other arm. Samples sent for laboratory for investigations. Leftover blood in bag and blood transfusion saved. Post transfusion sample of blood of the patient should be taken. Complications of blood transfusion reactions, that is mismatched blood transfusion reactions, are febrile reaction, allergic reaction, circulatory overload, hemolytic reaction, reactions due to infected blood, thrombophlebitis, air embolism, transmission of diseases like HIV, hepatitis B, malaria, syphilis, transfusion hemosiderosis because of the overload of the blood, complications of massive blood like citrate, potassium toxicity, post-transfusion purpura because of the dilution of the blood. Investigations of blood transfusion reactions. First, detailed history. Second, regrouping of patient and donor's bag. Third, recross matching of pre-transfusion sample of patient and donor's bag. Post-transfusion urine microscopy, occur blood test for hematuria. Blood microscopy to see clumps of RBCs, centrifuge and see for hemolysis. Direct Coombs test on patient's blood culture on blood from the bag. Strategies for minimizing transfusion transmitted bacterial infection. There are various strategies to prevent the transfusion related septic reactions. So, improve donor selection, improve disinfection of manufacture site, diversion, optimizing storage temperature and time, lipodepletion filter, overnight hold, optimizing transfusion indications and triggers, increased use of apheresis derived platelet concentrates, bacterial screening testing, pathogen reduction.
Hope you find this session useful for your understanding and for your exams. Thank you.